the health
This
the
meeting
health
is being recorded.
the Health Equity Super NRT. I I just want to make note that we are not allowing AI recordings in this meeting. So if we do see that AI recording pop up, we will be removing that. So I just want to let you guys know that, because I see it pop up sometimes and it doesn't always have the best results in the end. So we move on to the next screen. Just want to remind you all about who the Health Equity Super NRT is. Remember, I'm going to be reading some of my own notes. So don't think I'm ignoring you. I'm just reading my notes to make sure I get it right. So just reminding everyone that the Health Equity Super NRT was created as that umbrella group. As we restructured and did some other things under Open, our thought process was to make this group just be comprised of everything that Open was about. The NRTs, which is our network response teams, our ROC, our NOC, the lever leads, our Open members, really providing that check-in and feedback loop back and forth to the decision-making bodies of Open. One of the things we wanted to make sure that we were able to do is to hear everyone. So that was really the thought behind when we created this kind of Health Equity Super NRT. It really wasn't to have another work group, but really an opportunity for us to share opportunities around education, integration, and accountability. So for us, it's really focusing on these three categories. And as you can see, the function is that integration of equity into all of Open's activities, and to identify integration opportunities across Open. As we continue to regroup, we'll continue to look at this, but I think at the end of the day, we'll always want to hear back and want to feed into one another as we move through our networks. So our desired outcomes for today, and of course I can't read my own notes because it's too small on that screen, but our desired outcomes for today, once again, is to have a shared understanding of the systemic racism in public and private oral health care systems. Additionally, an opportunity for us to collectively together discuss anti-racism in the oral health workforce, have some built alignment around the meaning and importance of cultural competency across a diverse workforce, and just really building some connections and adding some resources to support moving towards diversity, action, and impact in the workplace. So really providing some references and resources, and not just the physical references and resources that we'll share, but each one of you here is a resource, and kind of understanding that and kind of knowing that. And so not just looking at us, but that all of us show up, all 14 of us show up with our own resources and references. So as we continue to kind of chit chat in the chat, we've identified where we are, where we're joining from, and who we are. What do you hope to learn from today's session? Why did you show up today? Not my students, not just to say because Christy said we had to come, but why outside of that would you be interested in showing up in a workshop that's talking about oral health, that's talking about equity, that's talking about justice, and all of those things that we hope that our lives will be inclusive of. So if you guys can just put that into the chat or come off of mute and just let us know what your thoughts are. Miranda, can I call on you? Just because she has been giving the biggest smile. The biggest smiles is making me feel so warm. And so I just want to say welcome. Why don't you join us today? I'm gonna put you on the spot.
Thanks. I'm happy to be here. And I guess why do I care about oral health and health equity? It's a kind of a big question because it's my whole career. It's what I centered my whole career about for the last 20-ish years. And so, but, as a kid, I know that my mom struggled to get me access to dental care. And, I vividly remember her crying because I had a cavity and she didn't know what she was going to do about it because there was no way she could afford to pay for that. Right. And so from the get-go, I knew I was interested in public health even before I was interested in dentistry. And then when I went to dental school, I decided that was going to be my focus, and it has been. And I've worked with tribes since I graduated from dental school. I also had some moments where I, some like 5 years of various times where I worked in private practice, because I just, wanted to learn more about how healthcare works and how it's delivered. And I did volunteer work in all these countries because I know that there's a better way. And I know we're not there at all. I thought becoming a public health dentist was going to solve it. And then when I worked as a public health dentist, became so clear to me that I wasn't solving it by just doing filling after filling and trying to do 1,000 fillings. That doesn't work. It doesn't solve it. And so I kind of backed up and I went back to school for public health. And I was like, okay, what is the answer? Because this is not answering it. And there are a lot more answers and they're not being implemented enough. And I'm sure there are more that we don't know about yet. So that's my biggest interest, is see how I can solve it.
I think that's fair. And that is a great answer. Can you guys hear me? Okay. I think that's a great, and so is that for me, it's kind of listening to that, is that what do you hope to learn from today to continue learning? Just to continue to learning where we are, where we can go, and who's doing what. I know people are putting things in the chat, so please share. What do you hope to learn from today's session? So although we have some thoughts and some ideas that we have put together, myself and Francis and the team, at the same time, you all have ideas on why you're joining us today. And I see friendly faces all through here, and I just want to say welcome. So please put into the chat. I don't see it blowing up yet with why you're here today. So please put that into the chat. I think Miranda started us off with a great way. Jan? Hey, Jan.
Yes, hello. I'm here. I've been wanting to come here since its inception, and I guess I just never made it. At this point, as we're moving toward some national sessions, virtual, but planning those, I kind of need to get a feel for the other NRTs and what they're planning. And I think you mentioned that, Chrissy, like what's going on with everybody else and how that is going to come together in the next couple of months as we move these agendas forward. So I'm happy to be here. I've been here for many, many years and always wanting to learn more.
Thank you. And I think that's fair. We do have a lot of work. We are planning the convening coming up, our virtual convening. And so just thinking through and remembering why the Health Equity Super NRT was created. So just remember some of our ground rules as we move forward today. We just want to keep those in mind. I'm not going to read them because we're all pretty good at reading those ground rules, but also furthering that discussion around recognizing that there's a lot to overcome historically around biases. So we want to recognize that and bring that into the room. We want to acknowledge that we are all systematically taught misinformation about our own groups and about members of other groups. There will be no blaming here. We agree not to blame ourselves or others for the misinformation that we've learned over time. That's part of coming into these spaces. We want to make sure that we're respecting one another. We want to listen respectfully to one another without interruptions. We all have a thought, because a lot of times we're already thinking of an answer. Before the person finished their thought, we already got an answer. We want to make sure that we kind of sit back and just kind of respect the thoughts and let them sit into the room sometimes. And I always say that silence sometimes is the best thing, because sometimes if we're just silent for a moment, you'd be surprised at what you hear. Think about that. We want to just really think through our own individual experiences. We agree that no one should be required or expected to speak for their whole race or gender. We know that often happens. We can't. And we want to think through that as we move through these conversations and discussions. Today, we're just sharing our own individual experience on where we sit. We want to trust. You want to trust, once again, where the question just said, trust that everyone has come to the table to learn, to grow, and to share. We want to share the air. It goes back to just really, for me, respecting others, not interrupting, and sharing the responsibility for including all voices in the discussion. And sometimes, once again, everyone doesn't want to speak. It might just be silence because they want to think through what's being said. And we're not all experts. We're facilitating these conversations today, Francis and I, And I see a whole lot of what I would say are experts on this call, on this workshop today. And so once again, we are resources to one another. We are facilitators, we are not experts. We're gonna bring our knowledge and bring our information on what we prepared today. But remember, you guys are references to one another, resources to one another as well. And at the end of the day, if you need something, just ask for help. We're here to do what we can do to support one another through this work because it's not easy. But we come to it with self-awareness. We come to it with honesty and transparency as we seek to figure out how do we move forward collectively together with this anti-racist work. Because it's not easy, but we do it every single day, especially as Miranda noted, how do you really pretty much meet the oral health needs? And it's not as easy as we may think it is as practitioners or in other areas in which we come to this work at. Francis?
Thank you, Christy. So I'm Frances Walsh. I'm with the Open support team. And so I'm going to do a bit of grounding about systemic racism in oral health care. But as Christy pointed out, I do see a lot of experts and folks that I am familiar with. So I know I'll be going kind of overviewing for many of you. But I want to start us off with our open commitment to justice, equity, diversity, and inclusion. So this is the network's JEDI statement, which I will not read aloud to you, but just to let you know, the Health Equity Super NRT, it was formed initially to ensure that health equity was integrated throughout all of Open, that we have education and accountability to these principles. So this statement was developed in 2021, and the primary focus here is on internal reflection, and this is about action. So we want to make sure that the primary focus that we have is that these aren't just broad concepts, these are actionable items that we all can and should be taking. So despite major improvements, we've seen these data points before, and they've been with us for a time as we kind of described, this is what oral health as a justice and equity issue comes down to. So looking at the data, we know there's been major improvements in oral health for the population as a whole, and oral health disparities exist for many racial and ethnic groups by socioeconomic status, gender, age, and geographic location. So we know that non-Latino Blacks, Latinos, and American Indians and Alaskan Natives generally have the poorest oral health of any racial and ethnic groups in the United States. And interestingly, these socioeconomic inequities are observed across racial and ethnic groups, with Black and Mexican Americans carrying a higher burden, suggesting that race and ethnic adversely affects oral health independent of socioeconomic indicators. So there's a number of new reports that are out or that have been coming out that really take a look at some of these data. But to understand what systemic looks like across the oral healthcare system, we know that for access to care, communities of color often face barriers to accessing dental care, resulting in poor oral health outcomes due to disparities in dental insurance coverage, affordability, and geographic distribution of dental services. Oral health disparities also exist for communities of color. They experience higher rates of dental caries, periodontal disease, and tooth loss compared to white populations. For workforce diversity, there's an underrepresentation of racial and ethnic minorities in the dental profession. There's also stereotyping. Cultural competence is important. We know that many providers are not culturally competent or even culturally sensitive, and that has negative impacts on patient care. Where cultural norms or practices are misunderstood or even disregarded. So implicit bias in treatment, we see that held by dental practitioners, which often results in differential treatment based on race or ethnicity, and lack of research and data. Of course, there is a need for more studies and data collection efforts to fully understand. But of course, these things are not really being studied as closely as perhaps they should. So just to give you a few more data points before we get into our discussion. So this shows the racial and ethnic diversity across the US dental profession from 2010 to 2018. So you can see the blue line representing white providers. That looks like the majority of the workforce, right? And then so we see Asian as the next majority represented, followed by Hispanic and Black providers. And then so even further down into like drilling down into this, no pun intended. But so looking at the implications of the lack of professional diversity, so we know that somebody else is coming in. So we know that the implicit biases among providers that affects the clinical decisions, and studies have shown that it's in particular when patients are Black, and that when we have patients of color come in, they experience higher levels of compliance and satisfaction when treated across the board by practitioners of their own backgrounds. And so while oral health inequities have been attributed to behaviors such as tobacco use, poor dietary choices, the major driver of these inequities appears to be reduced access to quality dental health services due to limited access to a dental provider and or lack of dental insurance. Historic and ongoing policies of racism have created large racial and ethnic variations in income, education, employment, and wealth. And those are strong predictors of access to health and dental insurance. So this comes from the Journal of Dental Education in 2019. But you can see here, like from the providers who take Medicaid and public insurance, those percentages are the likelihood of providers of those racial and ethnic backgrounds. So both taking Medicaid and public insurance, what percentage of their practice goes to that, as well as working in underserved areas. So we see that the white providers are much less likely to be accepting public insurance as well as working in underserved areas. So I will pause after all that to set up some breakout discussions for you all, to just talk about like, what are some of the ways that you have seen systemic racism show up in your work in the oral health workforce. And so I will pause there. Do we want to take any questions before breakouts or see if there's anything for the full group?
There's one question in the chat. I can't necessarily answer that. You may be able to, Francis, or someone else on the call. So US providers being dentists, or does it include hygienists as well? I think that was in reference to some stats that you provided, Francis.
I will have to go back and take a look. I thought it was dentists only, but it may be the entire workforce. And I included this article in the resources as well. So we
will be sharing those. Yeah, I did put a note in there that all the resources will be shared after this presentation.
I can say,
thanks, Parrish.
Yeah, I can say that I believe in the studies that we were just doing on dental hygienists that 95 to 97% of all dental hygienists are white female. So it's really interesting that not only do you have the racial disparity, but also gender.
Thank you. All right.
Okay, so I am going to go ahead and create these breakout rooms. There will be 15 minutes and you all will have 4 participants should have 4 participants per room. So creating those.
People are coming back.
Welcome back.
Welcome back. Welcome back. Do y'all remember that? Older people might remember that. Welcome back. Welcome back. Welcome back. Welcome back, Carter.
Yeah, that's it. Yeah, exactly.
Showing my age now, but all right.
So
all right.
Welcome back, folks. So we're about to jump into the next phase of our presentation, but we want to just take a minute and see how were those breakout discussions for you. If there's anything that anybody wants to lift up, any conversations that were had. What were you all spending your last 15 minutes sharing?
Anybody, somebody, put it in the chat if you're a little shy. Now I know y'all was talking about something in the breakout. Maybe you wasn't talking
Oh.
about what the question was.
I'll go for our group. We started off with not admitting that we didn't copy the question down completely. So then we were kind of, thrown off a little bit about that. Then we went a round of introductions. And then based from the vantage points, we talked a little bit about where diversity is showing up in the curriculum for dental hygiene, specifically in their ethics area, as well as different pathways to dental school, dental hygiene school, dental assisting school, and reaching as far as like high school level curriculum. And then from my vantage point, which is more corporate dentistry, I haven't seen a real lot of changes or a lot of talk in that area as far as any type of anti-racist work going.
Thank you.
And
I
please
can
jump in,
follow.
jump in if I missed it, folks, from my group.
I think you hit it right on the nose. We, Jen and I and Nicole, we talked more about what reality is right now. And I would just say, following up, Kristen, from your comments, it was very telling. I retired from the American Dental Association last July. I've been a dentist 40 years, and I tortured the ADA for 15. But they jumped on the bandwagon with diversity and inclusion. And it would have made sense to me because so many other people, including Open, were actually trying to address this. Lend your advocacy and your numbers, even if you're an old white guy association, let's get at the table. And the unfortunate thing was, no, we're going to do this ourselves. And I'll just say, when you look at the numbers, women, dentists of color, young dentists are not joining organized dentistry. And that's one of the reasons why. The do as I say, not as I do, just doesn't cut it. Obviously, I have my own point of view, but Kristen, I think you hit the nail on the head. So thank you.
Thank you for that.
Rebuttal,
Anybody else
Jan.
would like to share? Anyone else want to share any thoughts? Maybe you didn't bring up something in your group. Maybe you did. Anybody else want to share? Share.
I can share a little bit.
Jonathan?
So in our group, me and Tia, we're in college students, so we don't really have much experience of like systemic racism in terms of like workplace environment. So we kind of talked about like our experiences in college and like seeing like that institutionalized racism in that aspect.
Thank you. All right. Francis, did you have anything else? Thanks, Steve.
Sorry, I am off mute and already getting my screen share ready, but no, that's great. Thank you so much. And also, as Christy had mentioned, we encourage you, as we'll be following up with a number of resources, a few tests that you can take, a few articles, documentaries that you can check out, but really encourage you all. You all are the resources that we hope that you walk away from this meeting and workshop with. So, be sure if there's anything that you didn't finish off in those breakouts, please reach out to one another, reach out to either of us if there's folks that you spoke to but haven't been introduced to yet, so we can try to make those connections. But I will pause and say thank you all so much and turn it back over to Christy.
So we're going to continue to move it forward. If you guys have any thoughts, just please throw them in the chat or just come off mute, raise your hand, whatever. But thank you guys for sharing. So as you guys kind of think through and kind of reflect on the conversation that you already had, how do you impact that environment? How do you, as a practitioner, as a student, as a retiree, how do you impact the environments in which you come into? Just kind of thinking through that. How do you bring diversity into those spaces? How do you reflect on it? really sitting back and reflecting on it. And an opportunity for that breakout was really just to think through some things as we begin to have those conversations, as we share what happens in our workplaces. It's not always a comfortable conversation, but it has to be honest and transparent. And I think, as Steve noted, it's the reality. One thing I wrote down is the reality. He said the reality in dentistry. The reality is no one wanted to get on board but even as we get on board, we still want to do it our way. And so what does that way look like? How does it feel? How do you impact that? How do you impact that way? How do you look at it from your perspective? Miranda talked about her experiences and how she sought to change it and how she continues to seek to change. I've heard about curriculums. So just thinking through that, even as a student, you come into it, you're not always knowing, or you're not aware of kind of the things that are transpiring around you, especially as you move into these public health spaces. And so just thinking that our sharing, us having conversations helps us to open those doors. And so if you kind of move to the next slide, one of my favorites, as we know that for sharing to take place as you all did, you really had to be open. You had to have a conversation. In order to have that conversation with someone, you had to reveal yourself. From the prolific James Baldwin, and if anyone get an opportunity, just look at some of his, he was an amazing advocate, social justice advocate. If you get an opportunity to look at some of his interviews, you kind of see and hear some of those things, but you're revealing yourself in those conversations. That's even within your own workplace, your own environment. So when I say, what do you bring to it? What do you bring to it? What do you think about it as you're in those spaces? How can you impact? And you might not think that the impact you have is large, but believe you me, Steve, you already know probably those little conversations and you banging the hammer on the head continually help kind of move that needle. And sometimes you looking at the big picture in essence. And so sometimes looking at the big picture is essential, but taking small steps that show measurable results is the first step. Take the step, no matter how small that it is. And so when we think about that, you can go to the next slide, that's fine. And when you think about that, and for us, what we wanted to do was kind of bring that workplace piece, bring your impact into the continuum. I'm not sure if a lot of you are familiar with the continuum. It's been around forever. It's actually called the, let me get all its names because it's a number of names that you all may be familiar with it by, but it's the same thing, the continuum of cultural competence, the cultural proficiency continuum, the spectrum of competence, all of those things being really looking at the cultural competence continuum. And it really provides language to describe unhealthy and healthy values and behaviors of persons, policies, and practices of your organizations, your workplaces, and really an opportunity for you to look at it from a high level, but also be able to look at it from an internal level. What are you doing to add to this environment, to impact this environment? So just think about the discussions as I go through these 6 levels. Think about the breakouts, think about where you are. And hopefully the continuum levels will hopefully provide a framework to kind of help you as you continue through this journey. And we all know that it is a journey. And if we start at that far left with cultural destructiveness, and it's exactly what it sounds like, right? And it's really about, it's in red. Red is not always good. Red is stop. Red is those things. It's an alarm for you. And really it's those attitudes, policies, and practices that are destructive to cultures and individuals within the culture. So there's no opportunity to think about anyone else. It's that forced assimilation. The rights and privileges are for the dominant groups only. That's that cultural destructiveness. And unfortunately, I'm sure there's organizations out here, individuals that function from that perspective. We see it in today in our society, in our news. Cultural incapacity. It is when we do not seek, organizations or persons do not seek the culturally, to be culturally destructive, but they lack the capacity to help. So there may be some discriminatory hiring, lower expectations for people of color, and really the racism maintains the stereotypes. So really it's the status quo of what it is. I'm not necessarily trying to be a particular way, but I am being a particular kind of way. We continue to move forward, and then you have cultural blindness. And we see that I don't see color. Everyone is the same. There's no differences. You know, color or culture makes no difference. All people are the same. Approaches are universal. We're just going to give it all. It's going to work because this is what the dominant society or the dominant group's measures are. And that's how we or that group would move forward. It ignores those cultural strengths. It encourages assimilation. It blames the victim. And the eligibility for those services that we often provide, dental services or their other, it really maintains people to just kind of equals the assimilation. You have to be here because this is where we say it has to be. So that's that middle. So then we get to move a little bit further. So has to get better, and it does get better, of course. And that's that cultural pre-competence. So it implies movement. There's something going on. People are having those discussions. Things are in your head and you're saying something has to be different. And I know we can make a difference here, but what does that look like? You know, it's that it relies sometimes on the weaknesses and attempts to improve, but sometimes it's the false sense of improvement. So I know we're being a little discriminatory in our hiring practices. So we want to make a little intentionality there. So let us make sure we hire some people of color. Tokenism, but that's where it stops. We're just going to hire them. We do nothing else to foster or support that system to really help move that cultural piece forward, to help grow the organization in other ways. So really thinking through it as tokenism. So those parts, but we're moving to a better par. We're moving towards cultural competence, and that's really where those organizations, they exemplify cultural competence is the acceptance and respect for cultural differences. So really looking at those differences and taking them for what they are and really trying to understand them. Some of the things that organizations that really are at that cultural competence part you may see is they may create a mission statement that articulates principles and rationale and values for cultural and linguistic competence in all aspects of the organization. They may implement specific policies and procedures that integrate cultural and linguistic competence into each core function of the organization. That's a lot of intentionality, and that's a lot of work. They may also practice principles of community engagement that result in the reciprocal transfer of knowledge and skills between the collaborators, partners, and key stakeholders. So it's not just about the top-down approach. It's not just about this is how we want it to be done and this is how it's going to be done, but it's really about that bidirectional transfer of information that we want to take place, especially at a community level. I don't know everything about the community, but how I learn and how I make change is going into the community, making sure that I'm listening and bringing people into the fold with me to make sure as much as I can that they're part of all the processes that take place. And last but not least, green is always good. I would think sometimes we like green vegetables. They're good for us. Cultural proficiency is also good for us as well. And this is where they hold culture in high esteem. So it means a lot. It's the function of, it's everything. When we talk about equity lens, we work through an equity lens. We see through an equity lens. It's really all of that. Is really seeking to figure out using all the frameworks and theories and tangibles and resources to always work through an equity lens, holding that culture at the top. And some things you may see is organizations may develop a philosophy and practices that integrate health and mental health care. So really looking at things broadly now, not just situational, but really thinking broadly on a continuous level. Support and mentor other organizations as they progress along the cultural competence continuum. And it doesn't mean that they have it all figured out, but it means that they have some things in place that they like to share on how they are really addressing that within their organization, within hiring practices, within just acknowledgement within the organization and with its employees as well. They may also establish and maintain partnerships with diverse constituency groups, which span the boundaries of traditional health and mental health care arenas. So to eliminate racial and ethnic disparities in health and mental health. So really thinking broadly, how do we bring people together? How do we engage broad groups? How do I not just think about what we're doing, but think about
We can't
Christie,
hear you,
with
Christie.
this-
You're
We
mute. I
can't
think
hear
you might be
you.
muted.
Christie.
Yeah, Christy, we can't hear you. Um,
Nope. Can you hear me?
yeah. No, we can.
Okay, I'm not, my phone is all these eye products connected together, all this Apple stuff, just doing its own thing. But this is where we want to go. We want to all get to cultural proficiency. The goal is to get there, but it's a journey. And so if you go to the next slide, the ideal is that we never really arrive there. The journey continues. So as Miranda said, I did this, I did that. I think that was the best example ever to kick us off today, because it is a journey. It is a continuum. And to have complete cultural competence, you can never be fully attained. Rather, it is a lifelong process of learning, growing, and changing. We have to be willing to be honest and transparent in our interactions with others, within our interactions. So that means with our families. My thing is, always say, it's great to come to a meeting and talk about equity and diversity and justice and all those things. We can recite what's been given to us, we can read the notes, but what is your everyday practice? Because that's what shows up in your workplace. You can't talk what you don't practice every day. That's just me. But I think when you listen to like Miranda, it's like I'm trying, and she's trying to practice it every day, making sure that it's engaged, it's part of the work, it's part of the life, it's part of a lifestyle. It doesn't stop. When I hang up today from this workshop, that practice of equity and all the spaces, oral health spaces and other spaces that you all touch, it really doesn't stop. And so just knowing that I can never say I'm culturally competent. What does that mean? It means that I'm on a forever journey. I'm a forever journey trying to understand people. And I think that's what we have to bring to our work. And you can go to the next slide, Francis, and you can pipe back in. Are you coming up?
Great. Thank you, Christy. So we wanted to open up the rest of today for a group discussion and talk about how do we sustain this work, not only as individuals within and across organizations, also within and across organizations or communities, sorry. And if there's any super impactful articles, podcasts, videos that you would like to share with the group, or other discussions, conversations outside of here that you've had that have been meaningful to you, anything that you want to share within the space, and in particular, how do we sustain this work? How do we make sure that we as individuals stay true to ourselves, stay, involved and engaged? And I'll pause there and see who wants to come off mute.
Any thoughts? It's a whole lot of folks, but I know I have a lot of thoughts on here. Steve?
Could we end the slideshow, and that way we can see everyone?
Yep. We can put the questions in the chat and we can open the conversation up. Thoughts, feedback, just thoughts moving forward.
I can share a little bit of my experiences that what's been helpful to me is reading things and hearing things that kind of, it sounds silly, I think, when I say it out loud, but to give me permission to not worry about everybody equally and instead have that equity lens as opposed to an equality lens, right? And so because sometimes the person or the group that's already doing okay doesn't need the focus as much. And but I live and work in a world of dentists a lot of times where there's not as much sensitivity to cultural issues and race issues. And I want to, so like the book, How to Be an Anti-Racist, really does just blatantly give you permission in a way to say, we don't need to worry about everybody. We need to to give preference and things in a way that is anti-racist. That because if you leave the system the way it is and keep working in that way, it's not going to shift the demographics. It's not going to do anything. And a giant thank you also to Dr. Wolf, who is here in the room, for during a meeting not terribly long ago. I had a moment where I was like, well, maybe not everybody's going to hear this message in the right way. And, and she said, and I so appreciate it, she's like, look, it's not your job to tell people how to hear the message. It's your job to have the right message, right? And essentially, I'm paraphrasing, but it was something like that, she's like, stop worrying about that. And so that was a big help to me. And I want to thank you for that. So, but I'm always learning, and I know I can learn tons from all of you. So we'll love to hear more.
Thank you for that. We also want to reference, the book is amazing. It is absolutely amazing. We also want to, I'm not sure, Francis, if you put in the chat, but the 4-minute equity and inclusion test, as you're looking at your organization, some of you may have already done it. And I know everyone here is not part of the cohort and that, but I'm not part of the cohort, but being able to take that and just getting an overview really opens your eyes, especially if you're very transparent and honest in how you answer those questions and move forward. And so first, I recommend the book, The Anti-Racist Organization. It's absolutely amazing. And I'm gonna say it's an easy read. There it is, Josephine has it. I don't know, I'm gonna say an easy read, but it's an easy read. It's gonna bring you right in, and you're gonna just be really saying thank you, because it's definitely a gift of thought and a gift of permission. But I do recommend, I think Frances is putting some things into the chat. So she did put the 4-minute equity and inclusion test in there, especially as we think about our organizations. And we want to come back to that. So maybe you did that last year. You want to come back to that. You want to look at where your organization has progress. If it is progress, we want to say, hopefully, is moved through that spectrum in a different way. Maybe it's stuck somewhere. Maybe it needs to take maybe we need to bring that to the heads of organizations or HR. So just some thought-provoking pieces that are brought out in that 4-minute equity test. Anyone else? We have time, a little bit more time.
Christy, I just want to share, I'm a firm believer in the big picture, to be able to tell your own story is important, and often it's an embarrassing story. But when you can laugh at your own inequities and your own foibles, it warms people up. And I would just share, I'm one of the sole white providers in an African-American, a clinic that served largely African-American folks in St. Louis. And I'm walking through the peds area one day, and I hear this mom talking about, my baby's been running off. And I immediately thought, what kind of hell of a mom are you? They make those little stretchy things where you can put your kid in a harness and put it on your arm. And, I had this look of superiority on my face. And this grandma looked at me and said, honey, come here. And she goes, that's diarrhea. And it was like, oh. And that was 37 years ago. And I remember that as clear as a bell, because it was a learning moment for me. Not to judge by first thoughts or first value, but to immerse yourself with quietness and see what's up. So, Ife, it wasn't you, but it was someone like you who took the time to educate me. So on behalf of her, thank you.
Thanks, Steve. And it is acknowledging those cultural differences, because immediately when you said it, I knew exactly what you were talking about. But it's those cultural differences. Those are the things that we have to think about as we are maneuvering through the healthcare system. I worked in dialysis for a very, very long time. And it's the cultural differences in understanding why people eat a particular way. My doctors didn't understand, well, why can't they just stop? Well, you can't expect people just to stop tomorrow, what they've been doing for 40 and 50 years. You have to put things together. You have to hear differently, and you have to want to. Steve, you heard her. You were accepting of it. You had to bring down that superiority. As you said, I looked with superiority, you had to bring that down from somewhere and realize it really wasn't about you. And those are some pieces and things to share to really accepting other cultures and understanding, you know, you don't have to function from the dominant perspective, so to speak. Anyone else? I know we got some thoughts. Jan?
So I was writing when you were talking. I was listening to, but I was writing after the last breakout. And the question for this discussion is, how do we sustain this work as individuals within and across organizations and communities? And again, you know, like taking on these giants like the ADA or ADHA or other big organizations that in reality, they're not with us. So if they're not with us, are they against us? And that just seems overwhelming. But what I have found since I've been home, you know, I'm going to jury fit at the local park district, you know, with 30 other people from all walks of life, is that it is individual. And I'll talk about teeth to all these people in my class who are on Medicare that don't have a clue. A lot of them have missing teeth that I would have been very superior. Like, how can you have missing teeth? You know, like front teeth. What did you do in life? But I have really learned that these people are sponges for information, you know, and as far as my community and what am I going to do, that's what I'm going to do. You never know who you're going to talk to that can make a link to another organization to talk to about this. One thing that Steve said to me, that is what I wrote down, is only 5% of new dentists graduating from school join the American Dental Association. We all have this inner need to feel part of something, part of a culture, part of a something. The dental profession is a culture, you know, that we've chosen and gone to school to be part of. But now the new people coming out of school don't necessarily buy into this good old white boy culture, but they still need to be a part of a dental professional culture, somewhere where they can be with their peers and talk about stuff just like we're doing right here about a problem. So I say, let's spend some time figuring out how to get these new dentists, even if they're all white, and hygienists, even if they're all women, to recognize open as a place where they can learn and share, not necessarily how to do, you know, the latest technique for root canal, but how they address this equity, inclusion, and justice issue that we're assuming they're not interested in, that they may be interested in as an open network. You know, I always used to have this little saying behind my aperture when I was practicing, and it was, tell them what they need, but give them what they want. So people's dental IQs aren't always very high. They come in, they don't want to be in pain anymore. That's the only thing they care about. So as far as equity and the justice and all of that, we have to address their needs first and the relevance of those needs first. This is my opinion. There was a book many years ago, the 80s, I think, called Race for Relevance. And it talked about how people are no longer part of these associations and organizations that have been around for 50 or 75 years because they're not relevant to those people anymore. We have to make equity within, you know, within the dental oral health community relevant to people that are just coming out of school. And see what happens. I mean, it's worth a try. I don't know that we have really tried that, we're addressing with the survey that you just posted, the equity survey within our own organizations, which, yes, that's important. But I think it needs to be a little more grounded in the whole idea of open or health progress and equity network. You can tell them, what they need. They need to be part of an equitable network of oral health providers, but give them what they want, give them that space that they can talk to their peers, even if they're not an oral health licensed professional, but they're working in public health or they're working in something even not really related, some other kind of public health. So that's my 2 cents
Thank you, Jan.
for the day.
Thank you. Thanks, Steve. Anyone, and there's some resources coming in into the chat as well. So I see some books coming in and other things coming in. So definitely, once again, as we noted at the top, this is an opportunity for us to be a resource and a reference to one another, for us to figure out when we talk about sustainability, that sustainability is inwardly, that sustainability is within our organizations, and that sustainability stretches out as well. We may not have all the answers, and I don't have all the answers, but I come to groups like this so we can formulate perspectives together in a diverse group. And when I look around this group today, it is very diverse, and a very diverse perspective has been brought to this table from across this country. I think that's just amazing in itself, is to have people from all walks of different parts of organized dental health here in this group today. So, Francis, did you have anything before we close out?
Yeah.
Anyone else?
So I do want to just call out what's been in the chat. If anyone wants to share their contact information with the group, I can include that in the follow-up. So some folks have already shared their emails. I've copied those over. If anyone else wants to share any additional resources, but I will go back to my screen share so that you can all take a look at a few of the resources that we've pulled together. And so just quickly, I won't go through each one. Is this not sharing? Oh, please. Sometimes my my Zoom does not want to. Well, if you can see it this way, it sometimes doesn't like presenter view. But so the anti-racism resources here on the left, this top article was the data that was shared with you all about the different provider racial and ethnic backgrounds, and the data that follows from implicit biases and patient outcomes. The 4-minute equity inclusion test that was dropped into the chat from the book by Shireen Daniels, that's the second bullet down, as well as the Harvard implicit bias test. So those are some quick tests that you can take. There's also documentaries, recent reports. So we have anti-racism explicitly, and then there's some toolkits and guides on the right for health organizations specifically. I saw a few additional resources shared in the chat, so I'll include those as well. And then I believe the only other thing for today is our upcoming workshop schedule. So the next workshop we'll have will be on September 26th, followed by November 14th, and it will be 2:30 to 4 p.m. Eastern both times. And I do have that evaluation link to share with you. So I will pause there because I think that was the rest of what we had to share with you all. But if there's any, remaining additions or anything to share with the group, I will pause.
I just throw in that if you are really thinking about what you can do to make a difference in your organization, that you think about one goal that you'd like to see happen and what steps you would take to get there. It's not going to be comfortable or easy, and to accept the fact that it may be somewhat uncomfortable. And if it is uncomfortable, you know you're doing the right thing. Because if it comes real easy, you're not making a difference. Change is always a little uncomfortable. So the other thing is to please use us and this group as your resources and someone when you run into challenges and pushback in your organization that you can reach back to some of us perhaps for ideas for next steps. But thank you so much for the work you're doing. It is so vital.
All right. Well, we can give you back 15 minutes in your day if there's nothing else, if there's no other resources. I enjoyed meeting some of you all for the first time today. I've enjoyed this conversation that we've had, and I hope to see you guys along the way. Thank you, Francis, for being a great partner today.
Thank you, Christy. Thanks, everybody.
Thanks. Bye-bye.
Bye.
Bye.